Just starting off this interview, let's take a look at a really remarkable or a big number, as they're saying today, which is how the United States is nearing 100,000 deaths as we're speaking right now. And we have about 1.6 million cases just in this country. So starting off this interview, how should we be processing these numbers? And 100,000 deaths, it's a huge number. What do you have to say about that?
So as we know, the number of cases are increasing as we start to test more and more individuals, as testing becomes more and more available. We're just going to see the number of cases rising with the number of people being tested. And with that will probably come an increased number of deaths as well. As more people are being diagnosed with the virus, there are people, unfortunately, that will also die from the virus. So it's really important to continue doing all the things that we're doing to try to prevent our exposure and infection of COVID-19.
This curve that everyone keeps on referring to, doctor, how they're saying that it's flattening. Is it truly flattening according to you? Are you seeing a decline in number of deaths or a number of hospitalizations wherever you're working?
So I'm located in New York, and I have been involved, in COVID-19 from the very beginning in New York and even up until now. And I can definitely tell you that the number of cases within the hospital itself is definitely coming down. That means that the number of deaths that we're seeing in the hospital also has been coming down. So as you know, flattening the curve is basically a public health measure that we're taking to decrease the spread of the infection. Initially in New York, we were really concerned that the hospital wouldn't have the capacity to meet the demands of the number of people who would have infection. So when we say flattening the curve, we're really trying to decrease the spread of the infection and decrease the amount of sort of burden on the hospital system so our hospitals can keep up with the sick people and take care of them.
Have you experienced anything like this pandemic in your medical career? Or have you seen the stuff that you've seen on the COVID floors anywhere else?
No, I haven't. And to be honest, I never thought that in my career I would ever live to see something like this before. When I started my training, I saw a lot of patients with H1N1 in our hospital, and we really had to learn about what to do to keep ourselves safe. We were learning about how to mask, put on PPE, and everything else. But I only saw a handful of patients in my hospital. I never thought that our hospital would be over flooding with a certain type of patient that we're seeing right now. And it's really really interesting to learn so much about this disease every day and to really be a part of history. But it's just something that I don't think we'd ever expect, and we're learning something new every day. It's almost like we're living proof of history, and I think that it's really made me feel like this is my calling to be a doctor, to be able to help in a crisis like this at this time.
What are some of your biggest concerns right now?
I think my biggest concern is that, we're flattening the curve. We flattened the curve, and now we're seeing people sort of start getting back to a little bit of a new normal life. I think my biggest concern is that people are going to get complacent. They're going to feel that, we flattened the curve, we're doing a really good job, and they're sort of going to back away from some of those really important social distancing measures that are really what's been keeping our society safe all this time. As our society reopens slowly, as businesses open, as people can go back to their jobs, it's really important to remember that we have to do this safely, that we can't stop doing any of the social distancing measures that we have in place, things like maintaining 6 feet distance from others, hand washing, wearing a facial covering or mask. These are absolutely important measures that we all need to follow in order to keep ourselves safe and to keep other people safe as well.
How important is social distancing in the next couple of weeks? When we are talking about reopening, we are talking about a lot of businesses coming back as well. The economy has to open up. What is your comment on that?
Social distancing is imperative. It's absolutely necessary to keep this disease under control. If we don't have social distancing measures in place, then we're going to have too many people getting sick, and we're going to go right back to the place where we started before we flattened the curve. We're going to see an increase in the number of cases, we're going to see an increase in the number of hospitalizations, an increase in the number of deaths, and there may be a potential burden and strain on our hospital system again. It's something that we hope that we don't have to look forward to in the future. But without socially distancing, we can potentially get there. So really important to make sure that you continue to do everything to keep yourself and your family safe, and to listen to your local health experts and your government for the plan that they have in place to make sure that reopening is done in a safe way.
You work with a lot of members of the community that are at high risk patients, especially focused on diabetes and other illnesses that we keep on talking about how they are, some of those people that have to be more concerned about COVID-19, perhaps have to take more precautions. Your take on at high risk patients and COVID-19, have you seen interactions? Is there a threat of that? Do they have to be more concerned about it?
Absolutely. So, we know that these high-risk individuals are the ones that tend to develop severe complications of COVID-19, meaning that high-risk individuals with problems with their immune system or medical conditions like heart disease or diabetes or cancer, they are at higher risk for developing severe infection, which might lead to them being in a hospital to have treatment for their infection, as well as needing the help of a ventilator in order to breathe. And really, I would say the majority of patients that we've seen in the hospital that are being admitted for severe infection, they do ultimately have an underlying condition or they're elderly. But that doesn't mean that people who don't have any of these risk factors can stay out of the hospital. We're seeing people who are young and healthy coming into the hospital as well. So it's important for those with high risk to take extra precautions, but it's important for people with even low risk to take a certain amount of precautions as well.
Patients with diabetes, why is that such a big concern for so many doctors, including yourself? What are some of the precautions that they must take according to you?
So as you know, amongst our own South Asian community, diabetes is so rampant. We believe that 1 in 4 South Asians have diabetes. And I can tell you that in the hospital, I'm an endocrinologist. I take care of diabetes patients. We're seeing a lot of patients coming in for diabetes. And I really do feel strongly that in some cases, their diabetes could have been better controlled had they taken the proper precautions before COVID-19 to really get their diabetes under control. So how can they do that? They can make sure they're taking medications to control their blood sugars. They can make sure that they're following an appropriate diet and exercise plan. They can work with their physician, it could be an endocrinologist or your primary care doctor, to make sure that they're getting the right treatment, the right medications to get their diabetes under control. Luckily for diabetes, we have something called a hemoglobin A1C, which is a marker to let us know how well our diabetes is doing. So it's really important that every single person listening who has diabetes make sure that they have a hemoglobin A1C that's up to date and that they're using that as a means of understanding whether or not their diabetes is controlled. We know that diabetes alone can actually decrease one's immune system if it's not controlled. The red blood cells can get infected, the white blood cells can get infected, and people can get infected with any type of infection, not just COVID-19. So this is really important, not just for today, but for every day, for everyone's future.
How important is for them to go see their doctor? Do you recommend actually visiting doctors if you have diabetes or if you have, other diseases such as heart diseases or other lung issues? Do you recommend they go and see their doctors?
Absolutely. And I think that's one of the biggest fears that, a lot of my colleagues have been having is during the pandemic, everyone was in their house, socially isolated, just the way that they should. But there were people also having medical issues, having heart attacks, having strokes, who are actually staying at home rather than going to the emergency department or rather than reaching out to their physician because they were too scared to go out into the community. And it's really important right now to realize that if you do have any symptoms, even symptoms outside of COVID, that might make you think, I might have to go to my doctor, I might have to go to the emergency room, that you go to the hospital and the emergency room because you need to be taken care of before something gets worse and it's too late. So we're seeing a lot of that in the community, people who've been sort of ignoring symptoms and then coming in when something has just gotten out of control, and at that point, they have more of a worsening outcome. So really important to take care of yourself. I actually just started seeing patients in my clinic in person, and a lot of the other hospitals and offices are opening up as well throughout the community, so you can still actually go into your office for a doctor's visit if you need to. And for those who are high risk or really concerned, we can schedule appointments through telehealth. We can do video encounters where we can virtually see you. We can even just call you on the phone if you're concerned and you don't have really good tech skills. So there's an option for everyone. All of my colleagues are working. We're here for you, and we're here to support you to make sure that you get through COVID-19, but you also get through life in a healthy way. Just because this pandemic happened doesn't mean that you need to stop living and taking care of yourself and all of your underlying health issues. So please get in touch with your doctors if you feel like you need to be seen.
And what are these symptoms that they should watch out for, especially these at high risk patients, the patients that have diabetes or high cholesterol or other issues? What do they have to watch out for in terms of symptoms?
So in terms of symptoms of COVID, I think that's what you're referring to. I think that the major symptoms that we hear about is, fever that's persisted for a few days, having a sore throat, having cough, having even GI symptoms such as diarrhea, which are sort of continuing and you don't have a reason to really understand. One of the other classic symptoms we've noticed is actually loss of taste and smell. That's actually a very common symptom that we're seeing of patients who are developing COVID. And honestly, as the days progress, we're just learning so much more about this virus and learning about so many new presenting symptoms. I just had a patient yesterday who was telling me that their skin was discolored, that their feet were discolored, they were turning purple and blue, and they really didn't understand. They had a history of diabetes and they were concerned about that. This is someone whose diabetes has always been under control, has really no other symptoms besides this change in their skin color. And I told them to get checked out by their dermatologist, who immediately did a COVID test and they were positive. And upon reading about it further, we find out that this is actually one of the clinical manifestations of COVID, can be discoloration of your skin or a rash that's unexplained. So people are developing all different sorts of symptoms. I think if you're concerned about something, really important to talk to your doctor to see what the next best test is. That might be a COVID test or it might be medication for something else, but it's important to have an open communication with your doctor.
And in terms of then building immunity and nutrition and also just working on your wellness, how do you sort of, suggest we all do that? There are so many complications, there are so many unknowns, even for the doctors right now. The community is at unrest, they're scared. What do you, suppose that would help them?
So I think it's really important to pay attention to all those things that you mentioned, Aditi. And often we forget about it. I kind of group everything together as self-care, taking care of yourself and putting yourself first, making sure that your mind is healthy and making sure that your body is healthy. So when it comes to your immunity, I think it's really important to make sure that you're getting enough rest, to make sure that you're sleeping properly through the night, which can often be, very hard during these times. Making sure that you're getting in the right nutrition. I've been telling a lot of people to try to incorporate lots of foods that have more vitamin C and vitamin D, because we know that those vitamins are really important for the immune system. So that's definitely one way of sort of combating against COVID-19 or any other type of infection if it comes your way. Making sure that you're taking time to exercise. If you do have a medical condition, making sure that you're taking your medications to keep that under control. So for someone with diabetes, that would mean making sure you're taking your diabetes medications and make sure that you're watching your blood sugar, that it's controlled and it's not going very high. All of those things are important in terms of self-care. When it comes to, mental health, I think it's, really important to be aware of the fact that you may be having all these underlying stressors that are affecting your psyche. Making sure that you're aware of the stress around you. And I think that's really hard for a lot of people to identify, the fact that stress is in their lives. But some of the way that you would know that is you might be having difficulty sleeping. You might be having some changes in your mood. You're more depressed. You're more anxious. Your heart is beating fast for no reason at all. You're having panic attacks. All of these things could suggest that you have some underlying depression or anxiety, in which case it's important to seek help and make sure that you see a doctor or see a therapist to sort of oversee any of these issues. I think it's also really important during this time to really stay connected, to make sure that you're keeping in touch with family, with friends. A lot of my friends are quarantining by themselves. They don't have any outlet in their own homes, and they find themselves socially isolated, and socially isolating themselves means that they're getting depressed, they're feeling alone, they feel that they don't have any hope. And I think it's important then to find somebody that you can connect with, whether that's a friend or a family, I think one of the things we've learned, from this pandemic is how small the world can be by using technology, by using video chat and cell phone and Zoom. All of these things just make our world a little smaller and allow us all to connect with each other in a different way. So try to connect with people, try to be involved socially with some interaction. I think that's absolutely very important.
This entire journey is basically something that the entire medical community had never imagined that they'd have to go through, and it's something that's very personal to all of you because you're really truly the frontline heroes. How has this entire experience, changed healthcare or just looking at patient care for you? And also, how has it changed your personal life and how you have to interact with your own family members and your own kids?
So this pandemic has absolutely changed all of our lives. It's changed our lives in the hospital. It's changed our lives, doing everything that we would do day to day. I think this is all just a new normal. It's a way that we're going to have to live until we have a better option in place, like a vaccination that can really protect us. And so, for me, I actually have a 2-year-old at home. And, it's really hard. It was really hard for me to even think about going into the hospital, seeing patients, or, being present in a place where COVID is very obvious, like a hospital setting, and coming home to my child. So I'm just really trying the best that I can to keep safe. So what I do is I have my own routine for when I'm coming home. I make sure that I'm sanitizing all my doorknobs. I sanitize my cell phone. I take a bath as soon as I come home because I've been around hospital patients, and I make sure that I wash all of my clothes right away. I do all of the things that I can to try to keep my family safe in the best way possible. That's the only way that I can live right now, moving forward. I have a lot of colleagues that actually sent their family away. They're living away from their family. We didn't have the luxury of doing that because we have elderly parents. And so we didn't want to put our family at risk too for potential, COVID infection. So we decided that we're just going to do this in isolation from our families. And that's another, concept that's been very hard, is staying away from our parents. My child is the first grandson. Everyone wants to spend time with him. Everyone wants to hug him and kiss him and hold him. And unfortunately, they can't right now. And it's probably the hardest thing for them because they find so much support in they find so much support and stress reduction in just spending time with family, spending time with their grandson, and they can't. So we're trying to do everything to limit our exposure to our family. We don't get to see them as often as we would like, and if we do, it's very limited interaction, wearing a mask. We're 12 feet away from them at times. We have to keep further distance because our son will run to them otherwise. So it's really a different way of living and being right now, and it's a new normal. It's a new normal until this passes, and I think I won't feel comfortable until I know I have some degree of protection against this virus.
Definitely. I have 2 questions left for you here. My first one would be, what is your focus for the next couple of weeks and in terms of patient caring? And also, is there any development you have for our viewers in terms of treatments or drug trials or even vaccine?
So over the next few weeks, our hospital is slowly going back to a new normal. So we are seeing patients in our hospital. I'm seeing patients in my clinic. We're making sure that in the hospital, in the clinics, we're doing everything we can to be precautionary. So we have social distancing measures in place. People are getting their temperatures checked. Everybody has to wear a face mask or a facial covering. So we're doing the best to protect our patients. So that's really important for you to know and for your viewers to know, because your hospital and your doctors are ready for you. We're here. We want to see you. And we're doing everything we can to keep our hospital and our offices safe. In terms of, what we need to do, moving forward, I think we just really need to practice this new normal. We need to make sure that we're doing everything to socially distance, making sure that there's adequate space between us and somebody else, more than 6 feet. We need to make sure we're wearing facial coverings. We need to hand wash. We need to do everything that we can to keep our house safe. That means sanitizing doorknobs, sanitizing your cell phone, your steering wheel. Anything that could have potentially been touched by other people needs to be sanitized. And so it takes a lot of time. It can take me over 30, 40 minutes to just go through my groceries and sanitize things.
Wow.
But it's the new normal, and it's what's absolutely necessary. I also think it's important, because there's a lot of false information out there, to remember that right now there is no treatment for COVID-19. We don't have a treatment for COVID-19 yet. There's a lot of clinical trials out there looking to see whether or not there's a medication that might work to help us. But right now, we don't have a treatment. The only treatment that we have right now is, we don't have one, but what we can do, to prevent getting exposed or prevent getting the infection is the social distancing measures that I just mentioned. So please, rather than trying all of these things that you hear about on the internet or from other people, it's important to stick with what's tried and true, and that is the social distancing measures. If a vaccine comes out, it may come out in a couple of months. It's not there now. We need to do this in order to keep ourselves safe until that option is present to us.
I appreciate your comment on social distancing. I think it's so important for all the viewers to especially realize that, we have healthcare professionals here on ITV Gold telling everyone to just take precautions themselves, because we can protect ourselves, and it's really important. My one last question to you has to be, I would love for you to give a message out to your, co-frontliners, all of the people that are really sacrificing every time of their day to really, truly help everyone in need. I'd love for you to give a message out to them.
So I think, it's something that I've said many times. I think that the one thing we've noticed is that we're all stronger together, which means that we're all here for each other. Even if somebody lives in a different state or a different country, a lot of the frontline workers, a lot of the hospital workers have been in touch with one another through things like Facebook or Instagram to help support one another to get through this. And so we all are here together. We're stronger together, and we'll get through this together. There is a light at the end of the tunnel. I don't think that this is something that's going to last for years. I think that there's a possibility, once we have a vaccine, to start getting back to a closer new normal where we can engage in normal daily activities like we used to. But until then, we need to be strong, and we need to support one another. I think that's the most important thing.